بسم الله الرحمن الرحيم.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah wa salatu wa salam rasulillah wa alihi wa sahbihi wa man wala. Assalamu alaikum. As my brother Imam Salahuddin mentioned, I am LCSW. I work in an inpatient forensic hospital. I've been working in the field of mental health for about the last 27 years. So I've been asked to talk about diagnosing depression in children, self, and others. So to start out, we have to say that depression is a very broad spectrum of diagnostic categories. There is major depression, there's atypical depression, there's psychotic depression, there is persistent depressive disorder, there's postpartum depression, there's seasonal affective depression, there's situational depression that's associated with adjustment disorder. So, you know, as stated, the category is very, very broad. But for the sake of our talk, what we like to do is stick to a generalized definition of what depression is. So in that, we would say that depression, otherwise known as major depressive disorder or clinical depression, is a common or serious mood disorder. Those who suffer from depression experience persistent feelings of sadness and hopelessness and loss of interest in activities they once enjoyed. Aside from the emotional problems that are caused by depression, individuals can also present with physical symptoms such as chronic pain or digestive issues. In order to diagnose a person with depression, symptoms must be present for at least 2 weeks. So in terms of formulating a diagnosis of depression, we'll be working with what's called the Diagnostic Statistical Manual, edition number 5, which is known as DSM-5, that is put out by the American Psychiatric Association. But before we get to that, I'd like to just talk about a minute the term sadness, which is a very central theme in the definition of depression. However, sadness and depression are two different terms. Sadness is a normal emotion. Everyone experiences it at some point in their life. Be it the loss of a job, the end of a relationship, or the death of a loved one, sadness is usually caused by a specific situation, a person, or an event. When it comes to depression, however, no such trigger is really necessary or needed. A person suffering from depression feels sad and hopeless about everything. This person may have every reason to be happy, but yet they have no ability to experience joy or pleasure. However, with sadness, you may feel down in the dumps for a day or two, but you're usually still able to enjoy simple things like a favorite TV show, food, spending time with friends. This isn't the case with someone dealing with depression. Every activity that they once enjoyed are no longer interesting or pleasurable. Furthermore, when a person experiences or is triggered some feeling of sadness, that stimuli does not enable the person to sleep as they normally did before, to remain motivated to do other things, or to maintain their desire to eat. However, with depression, on the other hand, it's associated with serious disruptions in the normal eating and sleeping patterns of an individual, and as well as the person not wanting to get out of bed for an entire day. So in sadness, you might feel regret or remorse about something you said or you did, but you won't experience any permanent sense of worthlessness, guilt, as you might with depression. One of the diagnostic features of depression is this kind of self-diminishing negative thought process or patterns. And finally, with self-harm or suicidal inclinations, they don't arise in a non-depressive sad state. However, those struggling with severe depression may have thoughts of self-harm, death, suicide, or even present with a suicidal plan. So as you can see, sadness and depression are two very, very different terms. So as I was asked to talk about specific demographics, depression as it relates to children. For adults, the defining feature of a major depressive episode includes depression that's nearly every day for a 2-week period. However, with children, that depressed mood usually manifests itself in a form of irritability. So some of the symptoms that are advised to pay attention to and be keen about are: one, irritability, sadness, withdrawal, or boredom most of the time. Number two, no source of pleasure in usual activities that the child normally found pleasure in. Number three, sleeping too much or sleeping too little. Number four, weight gain or weight loss. Number five, feeling hopeless or helpless. Number six, difficulty concentrating or making decisions. Number seven, feelings of fatigue. And number eight, thoughts of death or loss. In terms of teens and adolescents, a lot of these diagnostic criteria are also similar. However, in teens, the definition of a major depressive disorder, again, is at least a 2-week period during which either depressed mood or loss of interest is nearly in all activities. And like children, the adolescents, in terms of the mood aspect of their feelings, it mainly focuses on irritability as well. So some of the symptoms that you'll find present in teens as it relates to depression is anger or hostility, changes in their eating or sleeping habits, fatigue or loss of energy, or lack of energy, hopelessness, feelings of guilt or worthlessness, poor school performance, lack of motivation, difficulty concentrating, tearfulness or frequent crying, restlessness, agitation, unexplained aches or pains, and again, thoughts of death or suicide. In terms of adults, males and females, depression can really manifest itself very differently in men and women. So in order to try to show some of the contrast, what I like to do is just mention some of the distinguishing factors on how depression differs between men and women. One, women tend to feel anxious and scared when they're depressed. Men tend to feel guarded. Number two, women tend to blame themselves for depression while men blame others. Number three, women commonly feel sad, worthless, and apathetic when depressed. Men, however, feel irritable and angry. Women are often likely to avoid conflicts when they're depressed. However, men are more likely to create conflicts. Women turn to food and friends to self-medicate themselves when they feel depressed, and men turn to alcohol, TV, sex, or sports as a form of self-medicating themselves. Women feel lethargic and nervous when they feel depressed. However, men feel agitated and restless. And in terms of the last aspect, in terms of their differences, women easily talk about their feelings of self-doubt and despair, while men hide their feelings of self-doubt and despair and also consider it a sign of weakness. And lastly, in terms of the demographics, the elderly population, oftentimes kind of overlooked in terms of how depression affects them. The essential feature of a major depressive order is a period of at least 2 weeks when the person experiences obviously the same kind of thing: depressed mood and loss of interest or pleasure in nearly all activities. However, more common, or the most common symptoms for depression in the elderly population include persistent sadness, feeling slowed down, excessive worries about finances and health problems, frequent tearfulness, feeling worthless or helpless, weight changes, pacing and fidgeting, difficulty sleeping, difficulty concentrating, somatic complaints, and withdrawal from social activities. Another complicating factor when it comes to diagnosing depression in the elderly population is medical conditions, because medical conditions, especially if they're chronic medical conditions, they can trigger or worsen any symptoms that may be present of depression in the elderly population. Any medical condition, especially those that are painful, debilitating, or life-threatening, they can result in symptoms of depression, and they include cancer, Parkinson's disease, stroke, heart disease, lupus, diabetes, dementia, and Alzheimer's, and multiple sclerosis. So another complicating factor, again, with the elderly population when it comes to depression is the difficulty in distinguishing between depression and dementia. So it's helpful to have knowledge of some common symptoms that manifest in each. So as we comparably contrast them in terms of the elderly population, in terms of depression, mental decline is rapid. In terms of dementia in the elderly population, the mental decline is slow. In terms of depression, patients can state the correct date, the correct time. However, when it comes to dementia, patients become confused and disorientated and may get lost, confused dates, or wonder where they are. In terms of depression, patients have difficulty concentrating. In terms of dementia, patients struggle with short-term memory. In terms of depression, language and motor skills are slow but normal. In terms of dementia, writing, speaking, and language skills are impaired. In terms of depression, elderly populations notice and worry about memory problems and confusion. However, with dementia, patients don't notice or seem not to care about memory problems and delusion. So it's a very, very, very different presentation in terms of the way that each of these demographics can present themselves. Just some quick points on terms of how we can support each demographic in terms of, the presentation of depressive symptoms. When it comes to children in the home, the family and the parents can encourage the child to engage in some kind of form of daily exercise. As my brother Omar was just saying, it's important to be up and active. So encouraging daily exercise is extremely important. Making time to talk. This is extremely important when it comes to children because counseling can help. It can help bring children out of, in their struggles and difficulties with their feelings and help them to verbalize them, to better understand them, and hopefully to better function and deal with them. So talking is very important. Cooking healthy meals. We are what we eat. And encouraging healthy sleep habits. In terms of the adolescent population, some of these are very similar in terms of benefit, in terms of support as well. In terms of that population, focusing on listening. So a lot of times we as adults want to fix the problems of teens or children. Sometimes just listening and not lecturing them can go a long way in providing some open rapport and sense of emotional support. Making one-on-one time is a big priority as well, because in that effort that you make, it allows you and your team to reconnect with one another, right? And it allows them to seek help instead of internalizing their feelings and not talking about them. Confront social isolation. This is something my brother Omar also talked about. So the lack of motivation might make it difficult for teens to connect with their peers. So during this time, they should be encouraged to reach out to their close friends and engage in activities of interest that they had prior to these struggles that they may be going through. Prioritize exercise. So regular exercise, and my sister Mubarakah can speak on this, regular exercise plays a vital role in improving mental health. So and aim for at least an hour or so or some kind of form of exercise. Like we said, a walk can suffice in that regard. And also if you do it with your teen, again, that also fortifies a healthy bond and relationship with you and your teen. Improve nutrition. A healthy, balanced diet helps combat fatigue and it helps feed the brain with vital nutrients and nutriments that can help the whole feeling of the sense of self be improved. And, sleep. Sleep, the insufficient or lack of sleep can exacerbate symptoms of depression. So we should encourage, our teens to make sure they do whatever they can possible to make sure that they get a sufficient amount of sleep. So lastly, with the adult population, male, female, and elderly, a lot of the support recommendations that go along with this demographic include involving themselves in some form of talk therapy, even if it's not with a professional in the psychiatric field. Ongoing discourse, as we mentioned, with teens and children is very important to help people feel supported, adults feel supported. But if it is with a professional, then cognitive behavioral therapy, which focuses on changing the way we think and look at situations and help build, effective coping mechanisms and solutions, can be very effective. So talk therapy, psychotherapy, engaging in support groups. And Omar had mentioned earlier about reconnecting with people. Very important to reconnect, as isolation can be very, very detrimental, as it is in his topic he talked, especially in this topic of depression. So
Absolutely.
encouraging support group activities, supporting, obviously, supporting contacts with the Muslim community, engaging in webinars such as this, engaging in Islamic discourse and programming is all very important. And lastly, lifestyle changes. Sometimes scheduling group outings, establishing a weekly visit, as our brother Omar had mentioned earlier, assisting with transportation for the elderly to medical appointments, adults also medical appointments if they're not, mobile, cooking and freezing healthy meals so that they can be easily prepared for people who are depressed, who don't have the motivation many times to cook for themselves, and to help create a system that allows for them to be able to express themselves and talk about their difficulties without being ostracized is so important. So in the sense of going over my time, I apologize, but inshallah, those are some of the recommendations and concerns that arise when it comes to diagnosing depression. Jazakallah khair.